Sometimes called lifestyle diseases, non-communicable diseases are often chronic and progress slowly over time. The Ministry of Health reports that 66% of recent deaths were caused by 4 NCDs, while 50% of adults between the ages of 25 and 64 have 3 or more risk factors. The ministry also reports that most NCD-related deaths are premature and preventable. Common risk factors are unhealthy diets, physical inactivity, tobacco use, and alcohol consumption. In her address to attendees, Chair-designate of the TT-NCDA, Donna da Costa Martinez, said civil society has made a significant contribution to the development of Trinidad and Tobago. She said the advent of the alliance will aid the government in NCD control.
The principal purpose of the TT-NCDA alliance shall be to advocate for high priority to be given to the prevention and control of NCDs in Trinidad and Tobago, principally diabetes, cardiovascular disease, cancer, and chronic lung disease, by harnessing the individual resources of the member parties and through joint advocacy to improve conditions for the early detection, treatment, and rehabilitation of persons suffering with NCDs.
Tasked with delivering the feature address, Chair of the Barbados NCD Commission and President of the Healthy Caribbean Coalition, Sir Trevor Hassel, made recommendations for the goal of sustainable development in the health sector to be reached.
Everyone needs to play their part. Governments, the private sector, and civil society. At the regional level, there has remained an ongoing political commitment to NCD prevention and control, in that all CARICOM countries have been signatories to the 9 global NCD targets and the Sustainable Development Goals. And most CARICOM countries have ratified the Framework Convention on Tobacco Control.
Here in Trinidad and Tobago, the main NCDs are heart disease, which accounts for 25% of recorded deaths, diabetes, which is the cause of 14% of all deaths, cancer, 13%, and strokes, which account for 10% of deaths overall. The Trinidad and Tobago Non-Communicable Diseases Alliance aims to advocate for development and implementation of multi-sectoral policies, programs, and quality services for prevention and control of NCDs. The alliance will also monitor the implementation of government's commitments and plans while building capacity for relevant NGOs. Dionne Baptiste, C News.